Hello everyone, welcome back to my channel. So, the topic that I wanted to discuss today is iron deficiency anemia. Now, this is the most common cause of anemia in about 80% females. In children less than 6 months of age, because they are exclusively on mother's milk, this is very common. And in adolescents, because of excess demand when the growth spurt is happening, iron deficiency anemia is very common. Now, what are the factors that affect iron absorption in our body? This is very important to remember. The first thing is ferrous iron more than ferric iron. This can affect acidic media, can again influence its absorption, and if the body has low vitamin C. Now, let's talk about the causes of iron deficiency anemia. Causes is very important to understand, because to treat iron deficiency anemia, we need to find the cause. The first, it has to be less intake, deficiency in diet. Second, pica, especially paper, earth, soil, and this eventually can cause worms, and a person can have iron deficiency anemia. Of course, worm infestation, both in children and adults. Celiac disease. Now, this is an absorptive disorder, especially of the proximal ileum, where the iron is absorbed. So this you have to remember. Bleeding from anywhere in the body, which usually is chronic bleeding. Maybe the person is having hemorrhoids, or the female is having excess menses, whether prolonged cycle or the amount can be too much, and it can be from the gastrointestinal tract. Now, what are the clinical features? Some general features that you may see here are dyspnea. A person may have difficulty in breathing. They may say that I have pain in my chest area. Then some specific symptoms of iron deficiency can be angular stomatitis, that you can see in the lips area. In tongue, you can see chiliosis. Again, atropic glossitis. Always check the mouth of the patient. Then check for pica. Check their nails. They will be brittle nails, and the nails can be spoon shaped. Okay. Now, patient can also present with edema. Now, what are the investigations that we can go for? So, the best initial investigation must be peripheral blood film, where you will see microcytic hypochromic anemia. You will see the MCV will be low, the MCH will be low, the MCHC will be low. Again, go for serum ferritin. This will be reduced, which will be confirmatory for iron deficiency anemia. Total iron binding capacity will be increased. Now, transferrin saturation is another thing that can be measured. How? It is actually, transferrin saturation is serum iron divided by total iron binding capacity. Now in this case we know that serum iron is reduced and total iron binding capacity is increased, so transferrin saturation will be very much low, decreased in this patient. If you see the RDW of the patient, this will also show an isocytosis. What is it? That the size of the RBC will be varying size of RBC. Okay. Now again RDW will be increased. Now what is the differential diagnosis in such report? You can think of thalassemia. But what is the differentiating point? In thalassemia, RDW is normal, whereas in iron deficiency anemia, it will be increased. Again, you can go for RBC free protoporphyrin. This is a test which will show raised free protoporphyrin. Okay. Now, what is the treatment? It's very important to be very obvious in this case that we have to treat the cause first. You have to check for any bleeding. You have to check, as I told you, here different causes. You have to check for pica. You have to check if the patient has worm infestation. You can check for celiac disease. And obviously, what is the diet of the patient? So, treat the cause first. Then, oral iron sulfate, often it is given. If it is very much reduced, parenteral iron dextran injection is advised. In fact, sometimes whole blood transfusion is done, especially in chronic cases. So these are the conventional treatments. If I talk about the homeopathic remedies which can really look after such cases, again I am going to stress on this, that we have to go with individual symptom presentations. We have to look for the totality and analyze the case and then choose our remedy. But just to list here, the remedies that really work well are China, ferrum met, ferrum phos, Calcarea phos, Calcarea carb, pulsatilla, phosphorus, Kalicarb, and natramur. I hope you have understood this topic, and please do subscribe because I am going to share many such clinically important topics and their homeopathic management also. Thank you so much.